Mr. Arun, what's your favorite food in Telangana?
Have a seat. I'm Dr. Sunil. I'll just take your brief history and you will. What is your good name?
My full name is Gio.
Okay. And what are the complaints you're having right now?
Right now, I'm having a lot of pain in my fistula area
Okay.
and my around my anus. I have a C-ton as well that's placed back in August of last year.
Okay.
Currently has- Thank you.
Oh,
Hello again, doctor.
How are you?
I'm good. I'm JR. I'm a new patient.
Oh, how was the travel?
Everything's actually smooth. I'm really glad that I'm here. Can't wait.
Nothing to worry. I have anyways gone through history in detail. So I'll give you a small test now. We call this video proctoscopy.
Okay.
Are you prepared for that?
I am. Let's do it.
Come. This will be painless, don't worry. Nothing to worry. So basically you have a complex fistula. It's type 4. Internal opening is at the level of dentate line here. There's a branch which is going higher up. We call it a secondary internal opening mucosal perforation. That's around 1 centimeter above the primary internal opening. And that is the reason it is not healing. And you have undergone multiple failed surgeries in the past.
That's why.
There are 3 branches. One of the branches called as transsphincteric. It's going towards your tailbone. There's another branch which is intersphincteric, which is going higher up here. And there's a small tiny branch which is going to the other side. So the plan is we are going to perform DLPL. You can scan the barcode and see the procedure here. This will be done with the guidance of 3D end-to-end imaging. So this is the 3D imaging that we're going to use. The advantage of performing DLPL under the guidance of 3D imaging is that we can see all the micro branches. So based on my patterns, I've seen 3 branches now. So this is a small tiny branch. It can be diagnosed with the help of 3D probe. This is done intraoperatively while performing the surgery. So if we see a micro branch, we will see the micro branch with the help of radial fiber. And then the abscess cavity is kept open for drainage. All the while, we are not going to touch your sphincter muscles. So it's a sphincter saving procedure. Yeah. So your sphincter muscles won't be damaged. But because of the previous surgery, you already have a scar and there's some damage to the sphincter muscles. That is something which we can't do anything at this moment. If required, we can fix that later on. The internal opening typically heals at 3 weeks. And the entire healing process from inside out will take nearly 6 to 8 weeks. But you'll be cured and you'll be perfectly alright.
Good. Thank you.
If you have any questions, you can ask me.
No, everything's clear. I like how you showed me the ultrasound and from step 1 all the way to the end. So I'm glad that I'll be with you for this journey for healing.
Perfect. Stay positive and you'll be fine.
Thank you.
Take care.
So, how many vaccines?
Everything's good. So we keep in touch on Facebook.
Yeah. Do you have any other doubts regarding the surgery?
No, everything's fine so far.
Okay. So we'll be scheduling a surgery for today. As I had already informed you that you will have to come empty stomach from 8 o'clock in the morning.
Okay.
So we scheduled a surgery somewhere around 2 o'clock in the afternoon.
Okay.
Okay, we'll be guiding you for the admission now. We'll be having anesthesia for the surgery, which will be on the lower part of the body. So you won't feel the pain of the surgery.
Okay.
Post surgery, you can walk same day, you can have your meals as well.
Alright.
We'll discharge you tomorrow morning. You'll go back to your hotel. If you need any help, my contact number is there. I'll give you my contact number. You can always get in touch with me.
Oh, thank you.
Okay?
Very amazing. Thank you.
Dr. Porwal and everybody else at Healing Hands. It's Jennifer. I just want to touch base with you all and let you know how well I'm doing. My healing is going amazing. I'm feeling great, better and better every day. I just want to thank you guys so much. I can't believe where I'm at right now. A couple years ago, the past 6 years, I've been so sick I couldn't hardly do anything, and now I am doing all the things I used to do with pretty much no pain at all.